Hi, my name is Elizabeth Pascal, and my disease report is on West Nile virus. So, some characteristics of West Nile virus. West Nile virus is a member of the flavivirus genus. Flaviviruses are a group of positive single-stranded RNA viruses that have arthropod vectors like mosquitoes. Other flaviviruses are the dengue fever and the yellow fever. West Nile virus is enveloped and icosahedral shaped, and this is shown in the picture, and it has non-structural proteins that fight antiviral responses of the body like interferons. West Nile virus can be neuroinvasive, so it may attack the neurons if the patient is badly infected. So some alternative names for West Nile virus. It's abbreviated WNV, obviously, and it's also called West Nile encephalitis, West Nile meningitis, or West Nile poliomyelitis. In Australia, it's known as the Kunjun virus. Another name is West Nile neuroinvasive disease, and the disease in horses is known as Lordage or Near Eastern Equine encephalitis. So some history about West Nile virus. In 1937, it was first isolated in a patient in Uganda. The index patient had a fever, but they found the virus was centered on the nervous system. In the 1950s, there were many outbreaks in the Mediterranean and in Egypt. In Egypt, they found through serosurveys that the virus was in humans and animals such as horses, birds, and mosquitoes. It became an endemic along the Nile River, and that's how it received its name, West Nile virus. In the 1990s, there was an outbreak in Romania, and there was a great number of infections in the central nervous system, as well as many deaths. In 1999, West Nile virus came to New York. They thought it was arbovirus encephalitis, but people had the IgM antibodies against arbovirus encephalitis, so they figured out it was not that. And birds were also dying at the same time, so they figured out that it was West Nile virus. And many believed the virus came from migrating geese, maybe from Europe, but they weren't quite sure if that was the case. In 2002, there was a huge epidemic in the United States. There are 4,156 cases with 284 fatalities, and it was mainly located in Mississippi, Louisiana, and Chicago. So places that get West Nile virus correlate with major bird migration patterns. So it's mainly located in places like Romania, Greece, Russia, and the United States. So some modes of transmission. The mosquito feeds off of the infected bird, and the mosquito gets the virus from the bird. And the main mosquito genus that transmits the West Nile virus is the genus Culex. The virus circulates the mosquito and gets into the salivary glands. The mosquito sucks the blood of a human or a horse, and then the human or horse get infected. The mosquito is the vector, and the bird is the amplifier host. And an amplifier host has high levels of the virus, so it can be transferred from them. And humans, horses, and other mammals are the dead end hosts. So they have low levels of the virus, so they cannot pass it on to other mosquitoes. So it can be transferred from person to person through bodily fluids, but this is pretty rare. So things like blood transfusions, organ transplants, or from mother to baby, but these are rare occasions. It can also spread in a lab setting, and it is not transmitted through casual contact handling infected birds or consuming infected birds. So here is a picture again of the mosquito as the vector and the bird as the amplifier host, and they pass it on to each other, and then the mosquito passing it on to the dead end host such as the horse or the human. So some symptoms of West Nile virus. 80% of people who get West Nile virus are actually asymptomatic, and so that means West Nile virus can remain dormant in the body. 20 to 30% develop flu-like symptoms known as West Nile fever, and some of these symptoms can include headaches, body aches, joint pain, vomiting, diarrhea, or rash. And the incubation period is 2 to 6 days. Symptoms leave after 14 days, but fatigue may stay for months, which is unfortunate. Less than 1% develop a neurological disease such as encephalitis or meningitis. Encephalitis is the inflammation of the brain, and meningitis is the inflammation of the meninges. So some symptoms of these neurological diseases can be headache, high fevers, neck stiffness, coma, disorientation, tremors, seizures, or paralysis. These symptoms can last for months, or they can be permanent. And 10% of people who get neuroinvasive diseases die. Damage can happen to the spleen, kidney, spinal cord, brainstem, or the central nervous system. So, people at risk. Basically, anyone exposed to mosquitoes are at risk of getting West Nile virus, so it's basically the entire population. People who are outside more often are also at risk. People older than 60 are more likely to get encephalitis or meningitis if they did end up contracting West Nile virus, and younger people are most likely to get those febrile symptoms if they contracted West Nile virus. So, prevention and treatment. There is no vaccine for this disease yet. There is a vaccine for horses, but not for humans, unfortunately. The CDC explains some ways to try to avoid getting West Nile virus, such as bug spray, mosquito nets, or wearing long sleeves. They're also trying to figure out ways to get rid of some of the mosquito population. It is important to handle the equipment in the right way in a hospital setting as well, especially with dealing with blood and organ transfusions. There is no particular treatment for West Nile virus, but patients must be hospitalized and given pain medication, intravenous fluids, and respiratory support in order to prevent any sort of secondary infection. So the research outlooks. They are on their way to getting a vaccine for West Nile virus, which is really good. The NIH funded the project of the West Nile virus vaccine, and Dr. Mark Slifka created what it's called the Hydrovax 001. It is hydrogen peroxide based, and many tests have been done on mice to make sure that their immune system stays intact when the vaccine has been administered. So they did move on to human trials in 2015. So hopefully in the near future, West Nile virus will be able to be eradicated.